The U.S. hitting a new single-day high for infections. The U.S. recorded over 441,000 new cases yesterday, 100,000 more than the previous high set earlier this month. The Centers for Disease Control and Prevention says that number could be the result of a backlog caused by testing sites being closed for Christmas. And these new numbers come as the CDC faces new criticism for easing guidelines on COVID isolation. We have Paul Gerke with more on that. Paul?
Good morning, Adrian. It seems like such a strange time to change those guidelines. That rolling day 7 average of new COVID infections hit 267,000 yesterday. That's the largest that number has been over the course of the entire pandemic. So why is the CDC changing course now? They argue it's because we know so much more about the virus. We have vaccines that are readily available. We have antiviral treatments. We know about the effectiveness of mask wearing. That said, there are still plenty of people scratching their heads at this.
Inevitably going to have more and more and more people getting infected with the Omicron variant.
The Centers for Disease Control is taking a step that's striking some as counterintuitive, relaxing its COVID guidance. From now on, anyone who tests positive and remains symptom-free is advised to isolate for 5 days instead of 10, followed by 5 days of mask wearing around others. The pivot comes as new infections lead to widespread sick-outs that threaten to paralyze vital segments of our economy.
People with important jobs in keeping society functioning may not be able to come to work if they're all out for a full 10 days.
The restaurant industry is dealing with a double whammy. Too many open positions and now too many workers catching COVID. Business owners are hopeful shorter stays in isolation will ease staffing shortages.
It appears that that could really help this industry getting people back to work as long as they are healthy and not symptomatic.
But critics contend the CDC is putting the economy ahead of public health, especially since the new guidelines don't encourage people who've tested positive to test negative before emerging from isolation. Dr. Jerome Adams, who served as Surgeon General under former President Trump, did not hold back on Twitter. If it's to keep the economy open, own it, he wrote, but don't claim it's science-based, yet ignore the most important science, the value of negative tests and high-quality masks.
New York Attorney General Letitia James has issued a statement, a reaction to those new CDC guidelines. It has strong, I can't believe I have to write this vibes to it. But she more or less says she wants employers to take a common sense-based approach when employees are returning to work, not to rush anybody back just because it's been 5 days and they may or may not still have symptoms. She says it's the only way we're going to get this virus out of the population, Adrian.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.